And on behalf of Adia, thank you so much for watching this presentation on financing your dental school education. And this is specifically targeted to those of you who are starting as first-year students in the class of 2016. Thank you so much for taking time to watch this. As you go through this, hopefully you'll see some key messages that you've seen before as you've been thinking about financing a dental school education. Certainly that dental education is expensive, but it is definitely an affordable and worthwhile investment, and we certainly think that will continue to be the case when you graduate. And there are lots of ways to pay for dental school. Hopefully you already know that because you've applied for financial aid with the financial aid office at your dental school. You're going to hear us talk about smart budgeting and responsible borrowing, and hopefully that's going to help minimize any long-term impact that some of the borrowing may have on your dental careers. And finally, you're going to be ultimately responsible for this, but hopefully you already know that you have a lot of help along the way. Now, as we go through this presentation, a number of things that we're going to call some considerations, things just to be thinking about as we go through some of the detail in the workshop. First of all, learn from your colleagues. I've had the great pleasure of working with health sciences students, including dental school students and graduates, for many, many years. But the reality is I don't have student loans, and I never had student loans. And so while hopefully you can learn from your financial aid office and with Adia's help the details on how the loan programs work, talk to your colleagues, those who are maybe second, third, or fourth year dental students that you run into. And if you happen to know any folks who are dentists, talk to them about what they did in dental school and the things that they think they did right in terms of paying for their dental education, and maybe some things that they wish they'd done a little bit differently. So we're going to tell you how the particulars of the loans work, but we would encourage you to talk to your colleagues. Who better knows how this stuff actually operates and plays out from day to day than those who've gone before you. We also think that you're going to find that although the amount of student loan debt may be a concern, the complexity of repayment is something to really keep on your radar screen as you go through dental school. There are lots of different repayment options for you, and really the trick for a good repayment strategy is to figure out how to use those to help you meet your own particular goals and objectives. But the complexity of the repayment is something you really need to keep on your radar screen. Something you may already know or suspect, and we're going to talk a little bit more about this later, is that there seems to be a continued shift of responsibility for financing to you guys and away from the federal government. And an easy example or perfect example of that is the fact that there's no more subsidy on new Stafford loans. We'll talk about that in a few minutes. So clearly the move is have you guys be responsible and not the federal government. Now we're going to talk about some forgiveness programs that may be of assistance to you. But once again, you're going to have to be footing this bill. The government's not going to be giving you a lot of help there. Certainly, we hope that presentations like this, and by working with the professionals in your financial aid office, and you see that down there at the bottom, we hope that this will help reduce any adverse impact your educational debt will have on your career decisions. For example, if you really want to do a residency or a postdoc program, we don't want you to be overly concerned about the impact that may have on your career choices because of your debt. So that's one of the reasons we're doing this workshop, and Adia is making it available to you. And finally, student loans are really just one piece of the puzzle, especially for those of you, and at least right now, if history follows suit, it will be the majority of you. As you look to get into a practice when you graduate from dental school, you may be looking at having to borrow additional money, perhaps for a practice. You may be someone who's also looking at trying to finance a mortgage, and those are different financial decisions, but your student loans are going to have a part in that. So be sure you educate yourself on the way the student loans work, because they are really only one piece of your financial aid picture, your financial picture, if you will. And as we already said, lean on the financial aid office for help. They're clearly the #1 resource for you. Now, the items to cover in this presentation, in this webinar, are some comments that we're going to make on the actual cost of attendance at dental school. And then we're going to look at the different loans that you could be borrowing in your student loan portfolio as a dental student. We also want to talk to you about some recent changes and the potential impact that they may have on your borrowing and your ability to borrow and your repayment. And some things, guys, just to keep on the radar screen during your 4 years of dental school. Nobody's trying to make you into a financial aid expert, but there's some things that we want you to be aware of and to lean on the financial aid office to help you with. We're going to talk briefly about student loans and credit, and then we're certainly going to leave you with some resources and perhaps some action items or to-do items along the way. So let's start with some comments on the cost. And when I do workshops for any incoming students or any students thinking about going to dental school or any of the other health sciences school, in my mind, there are three different kind of costs to look at. There's what we call opportunity cost. That's the lost income that you gave up by deciding to go to 4 years of dental school. And then there are what we call out-of-pocket costs. Those are costs that you have to come up with out of pocket to attend dental school each year. And then there are what we call financing costs. That's the cost associated with borrowing. And I have the last two highlighted because those are the two that we're going to talk about in this webinar presentation. This is simply an example of a first-year dental school student's cost of attendance. And you see a breakdown of tuition and fees, book supplies, room and board, transportation, miscellaneous, etc. Some of you may be attending dental schools that are slightly less than that. Some of you may be attending dental schools that are higher than that. But in general, you're going to see from your financial aid office a breakdown of costs like this. Hopefully you've already seen this, either on the web or when you applied for financial aid and contacted the financial aid office. Now notice that I've got several items highlighted in red, and my reason for doing that is when you look at the cost of attendance each year, and let me do a little sidebar like they say in Law and Order here for just a moment. Remember that you apply for financial aid each year. You're going to be doing this all 4 years of dental school, but we would encourage you to think about the overall cost over the entire duration of your program. But again, you're going to have a cost of attendance figure every single year. And guys, when you find this number, if you look at room and board and transportation and miscellaneous, and your dental school may have these done slightly different in terms of the way they categorize these. But if you look at this budget, these are the only items that I would argue you have any control over. You really can't do anything about the tuition and fee cost at your school. Hopefully you knew what that was before you applied and before you matriculated. You don't have a lot of control, at least as I understand, over the cost of books and supplies, and those are going to vary greatly during your 4 years of dental school. But those don't tend to be a large percentage of your total cost of attendance or budget. But room and board and transportation and miscellaneous, the living expense component, in this particular case, it's almost a third of this particular cost of attendance, this borrower's cost of attendance figure. And my argument there is that's something you've got under your control, and so anything you can do to limit those costs is going to help reduce what you borrow and ultimately what you end up paying back. So long story short there is when you look at your cost of attendance, be sure you get this number and find out what's under your control and what is not. Now the only real sermon I'm going to give you on this is right here. Your ability to budget now is really going to impact and influence your repayment strategy later. And folks, help protect the choices you make while you're in your practice or if you decide to do a residency or a postdoc program. So again, find out what that monthly living expense component is. I had the pleasure of working in financial aid for many years, and I used to tell students, you know, this is the budget that we came up with that we think pretty accurately describes your cost this year. But prove us wrong. Prove to us that you can live on less than that amount. So just because your financial aid office shows you a budget of $50,000 or $60,000 or $75,000 or whatever the budget is, try and get in under that living expense component if you possibly can. because that's really going to help you in the long run reduce how much you borrow and how much you pay back. Now, so they're out-of-pocket costs. Let's take a quick look at what we call financing costs, and this is the cost associated with borrowing money. This is what your student loans really cost you. And you probably already know this, but there are a number of factors that influence what it's going to cost you when you borrow money. First and foremost, the interest rates, and we're going to look at interest rates on student loans here in just a moment. But also something called capitalization, and I'll try to stay out of the weeds here, but you probably know about this term. Capitalization simply means the interest that accrues on the loans that you take out that you don't pay while you're in school and during any grace periods that you may have on your loans. Eventually that's going to be added back to the principal amount that you borrowed, and that can greatly increase the cost of the loans you borrow. So interest rates and the capitalization frequency is very important. Another very important factor is the loan you take out, is there a subsidy or is there no subsidy on that loan? There are some loans, such as Federal Perkins, Health Profession Student Loan, that are interest-free during school and during a grace period, and you need to work carefully with your aid office to be sure you apply for those loans. But notice I've highlighted no subsidy because the majority of you are likely to be taking out loans that have no interest subsidy at all, and interest is accruing along the way, and that is something that can greatly add to your financing cost. Now, another thing that's going to, or another factor that's going to impact what you pay back is, frankly, folks, whether you decide to postpone your payments when they come due, perhaps because you're going into a postdoc program or you're doing a residency program, or you decide that you really are ready to pay after graduation. And you may have already heard that clearly the majority of dental school graduates go into some kind of a practice pretty soon after graduation, and their repayment strategy is one where they want to start paying as quickly as possible. And also the repayment plan you choose. We're going to look at some repayment numbers here in just a moment, and you'll see, and I suspect you already know this, that the longer it takes you to pay a loan back, your monthly loan payment may drop each month, but that can greatly add to the financing cost of that loan. So a number of factors influencing what the actual loan you take out, what it's going to cost you. Those factors are perfect reasons why two dental school students could take out the exact same kind of, exact same amount of money, and because of different things such as their options about postponing and the different repayment plans they choose, they could pay back dramatically different amounts. So look for ways to reduce your debt and the ways to reduce your cost. And here are a few for you to kind of put on your radar screen and think about. We've already talked about controlling in your budget what you can. Also try to keep your consumer debt in check. Don't try to live like a practicing dentist until you're out and you're earning your income. So keep your consumer debt in check. Nothing wrong with using a credit card as long as you pay it in full each month. Now, pay interest as it accrues. You're going to see a reference toward the end of this presentation about talking to your family or significant other or partner, spouse, whoever, who may have offered to try to help a little bit along the way. And one way they may be able to help is to consider paying the interest for you, at least on one of your loans or some of them, as it accrues. That will greatly reduce the amount you're going to owe in the long run. So if somebody has mentioned they'd like to help, but they just can't come up with tuition and they don't have that much money to help you with, talk to them about paying the interest as it accrues. Now, bullet 4, target payments on your worst loans. This really applies for when you graduate and your loans are coming into repayment. But we want you thinking already like a fourth-year dental student. And for example, when we look at Stafford and Grad PLUS loans, those loans have two pretty dramatically different interest rates. And if you find yourself in a position later on to aggressively pay your loans, you do want to target the extra payment on the most expensive loan. You have plenty of time to learn how to do that. That should be covered with you at your exit interview when you graduate in 2016. We also urge you to be cautious with private loans. We're going to talk about the difference between federal and private loans here in just a moment. And then, of course, just budget wisely and borrow responsibly. So some proven ways to reduce your costs, the main one being watch your expenses while you're in dental school and control what you can and don't obsess about the rest. Now let's take a look at your student loan portfolio. These are the different kinds of loans that you may graduate with or you may use as you go through dental school. And these include Stafford, Grad PLUS, what we call campus-based loans. These are loans that are actually awarded by the financial aid office, by the school, and then private loans. And notice a couple of things on here. I have an asterisk beside Stafford, Grad PLUS, and Federal Perkins because those show up on a database we're going to look at in just a moment called the National Student Loan Data System, or NSLDS. You may already be familiar with that if you've already borrowed. We'll look at that in just a moment. But notice I've highlighted Federal Stafford and Federal Grad PLUS. You want to work closely with your financial aid office to see if you're eligible for Federal Perkins, health profession student loans, or even loans for disadvantaged students. These loans are subsidized loans and they have lower interest rates than Stafford and Grad PLUS. But the reality is not all dental schools participate in those programs. And again, you really want to talk carefully and work carefully with your financial aid office about those. The majority of you will be borrowing through the Federal Stafford program. And then those of you who max out on Stafford and still need additional funds may be borrowing from a loan that's called a Grad PLUS. So general rule of thumb is, first of all, obviously try to get scholarships and grants. I mean, that's one of the main reasons to talk with the aid office. But when you start borrowing, see if they have any campus-based funds available. But then you can expect to borrow from the Stafford and the Grad PLUS program. So let's look quickly at the particulars of those loans. First of all, you're going to see the reference to the Stafford loans being what are called direct Stafford loans, and that simply means that those funds come directly from the federal government. The Department of Education actually acts as the lender on behalf of the federal government. Those are called direct Stafford loans. Now, these are unsubsidized, and we're going to reference this again here in just a moment, but you may have heard that effective for enrollment periods starting on or after July 1, 2012. So depending on when you're listening or viewing this, could have been a month or two ago or several months ago, new Stafford loans for grad and professional students are unsubsidized. You can still borrow the full $40,500 per year in the Federal Stafford program, but it's all going to be in unsubsidized at a 6.8% fixed rate. You can't lower that rate. This is not a variable rate. The Staffords are at 6.8%. They have a 6-month grace period, which means you get 6 months to get your feet on the ground before you start entering repayment. If you decide to postpone and you're eligible to postpone when the loans come due, that's costly because, remember, the interest is continuing to accrue on the loans. Now, one of the advantages of Federal Stafford loans, because they're a federal program, there are multiple repayment options, and we're going to look at a couple of these here in just a moment. Now, once you max out Federal Stafford, if you need additional funds, and more than a few of you while watching this will, you can borrow through a federal program called Federal Grad PLUS, and you'll see the reference direct Grad PLUS. Remember, all that means is you're not choosing a lender for this loan program. The loan is being made directly to you by the federal government through the direct Grad PLUS program. This is also an unsubsidized loan, and it's at 7.9% fixed rate. Cannot lower that rate. Now, very important to know, no one at ADEA, and I certainly know that your financial aid professionals in the financial aid office are not going to encourage you to do this, but perhaps one advantage of Grad PLUS is that regardless of the cost of attendance at your school, you can borrow up to the full cost of your cost of attendance each year with Grad PLUS minus any other financial aid you're getting, scholarships, grants, Perkins, health profession, loans for disadvantaged students, and Stafford. So again, one advantage of Grad PLUS is you can borrow all the way up to cost of attendance, and that negates your need for private loans, which we're going to talk about in just a moment. Grad PLUS loans have something that I always say I always kind of thought should be called a grace period at